In this video, we will discuss simple interrupted sutures, one of the most common techniques used in the closing of skin. Suturing in general is a basic skill every medical school student should possess. It is used to treat patients with open lesions in the skin and is the final step in all surgical procedures. Before the suturing process, it is important to complete some prep work. After placing surgical gloves on the hands for safety, soak the suturing instruments in a very strong chemical called barbicide for approximately 10 minutes to sterilize.
Warning, barbicide chemicals are very strong and will burn through flesh. Be sure to wear gloves for your safety.
Afterward, tools should be left out to dry for an additional 10 minutes. Now it is time to sterilize the wound itself. Preferably, this should be done with iodine. However, if that is not available, then use soap and water or an antiseptic wipe.
If significant bleeding has occurred to the open wound, apply pressure and call 911 immediately.
Now inject a local anesthetic numbing agent into the tissue surrounding the wound for the patient's comfort.
Patients can have bad reactions to local anesthetics. In the worst cases, anaphylactic shock may occur. Review a patient's medical history before administering anesthetics or other drugs, and only administer if you are a licensed medical professional.
Now that all of the prep work has been completed, it is time to begin the actual suturing process. First, open the package of suture string. Note that the needle does not need to be threaded. It comes pre-attached to the string in its packaging. Using the needle driver, clamp about 2/3 down the length of the needle. Apply additional pressure between the thumb and ring finger until the locking mechanism snaps into place. Now in one hand, use the Adson forceps to stabilize the area. With the other hand, use the needle driver to pierce the skin at a 90-degree angle, entering from the healthy flesh outside of the wound. Now the needle that is poking out of the open wound should be fed through the bordering edge of the skin. Now detach the needle driver from the 2/3 point and reattach at the 1/3 point on the tip of the needle poking out the opposite end of the wound. Pull the needle all the way through its exit point as well as the suture material until there are only a few centimeters left poking out of the initial entering point of the skin. Now, using the needle driver, wrap the longer end of the suture string around the body of the forceps, making a loop in a clockwise direction. Then grab the short end of the suture material, only a few centimeters in length, and pull it through the loop, completing the initial suture. Now repeat step 7, but make the loop in a counterclockwise direction, effectively creating a square knot to hold the suture in place. Then, using the surgical scissors, cut the long end of the suture.
Note, cutting the suture string too short could result in the suture breaking, so be sure to leave it a few centimeters long.
Finally, repeat steps 1 through 9, completing simple interrupted sutures all the way down the wound until the lesion is completely sealed. Congratulations on completing a simple interrupted suture. This procedure can go a long way in preventing patients from irregular healing and from contracting major infections. Simple interrupted suturing can truly save lives.